Good afternoon, everyone. Thank you for joining us for our COVID-19 update for January 12th, our new time, Tuesdays at 2. Pleased to be joined by Dr. Gail Burstein, who you'll hear from shortly, as well as Karen Gambino from Deaf Access Services, who will be providing the American Sign Language. We have a lot to go over. I know there's a lot of questions on many topics. But let's first do some data information. As of January 10th, there were 45,575 total confirmed COVID-19 cases in Erie County. The 7-day positivity rate as of January 10th was 6.7%. As of January 8th, which is the most accurate date that we have, 1,333 confirmed deaths from COVID-19 in Erie County. 64 of those deaths were in 2021 alone, so from January 1st to January 8th, there were 64 deaths, or 8 deaths a day. On January 10th, there were 494 COVID-19 patients in Western New York hospitals, 80 of whom were in the ICU. 381 of those patients were in Erie County hospitals, 64 in the ICU, 42 on an airway assist. Unfortunately, another 7 died on January 10th. Those individuals are not included in the confirmed deceased that we have because they may have included individuals from another county. And 33% of patients on January 10th were under the age of 60 or 64 and under. On the screen, you will note the new COVID cases by zip code for the week ending January 9th. And we have it in a number based on the percent positives for those zip codes, with West Falls leading with a percent positive of over 14%, followed up by Alden, including 14% as well. I am not aware of an issue at the Erie County Jail, though we have received cases from the Wendy Correctional Facility in Alden, and those would be included in those as well, as just general in the population. We also have a high rate from 14202, which is the Buffalo downtown. Angola, not Akron. Akron would be considered a separate zip code, Akron, I was reading the wrong one. Akron, then a couple districts in Buffalo, then Angola, a lot of areas in the rural and suburban areas, but we are still seeing some very high rates in a number of our districts and zip codes across Erie County. This zip code sheet here are all of those above 7.0% for the week ending January 9th. We will release the full data set to the media after the press conference, but you can see there are some areas of Erie County that have very high percentage positives, including areas in our rural section, our suburbs, as well as the city of Buffalo. In general, the city of Buffalo is doing better than most of the other parts of the county, but there are some zip codes in the city that are not doing well. Hospitalization data, this is the 2-week chart that we've been showing you for quite some time. And as it shows, 68.2% of all Erie County hospital beds were occupied on January 10th. So we do have more than 30% of beds available. And 17% of all COVID hospitalizations were individuals in the ICU. ICU and airway assist numbers have remained steady over the past 3 weeks. We haven't seen a tremendous drop in those. We have seen a little drop, also commensurate with the general drop in hospitalizations. The 381 total for January 10th is the lowest that we've seen in the last 2 weeks, so that's a good sign. We've seen a decline over the last week or so, and as a result, that at least heartens me a little bit that we've done a better job of controlling the spread of the coronavirus. We're kind of coming out of what would be considered the Christmas and New Year's new cases. It's not unheard of for people to be hospitalized in the 6 to 7 day range after getting the virus. So we're starting to come out of the Christmas and New Year's spike that existed, and that's a good sign. That means that we think we're doing a better job with regards to the cases across Erie County. Mortality data, as I noted, 64 people have died in 2021 through January 8th, and we do have 1,269 reported deaths in Erie County for COVID-19 in 2020. So for every 1,000 people in Erie County, 1.4 of those died. It's a very sad total that we've unfortunately had to continue to increase. And we do offer our deepest condolences and sympathies to the family members of those who have perished from COVID-19 and continue to. Dr. Burstein and I are going to play a little back and forth here, but we did want to move right into vaccine delivery in Erie County. Since we administered our first dose through the Department of Health on January 4th, the Erie County Department of Health has given 6,907 vaccine doses to Erie County residents. These are all first doses. We have not moved on as a county Department of Health to second doses. There are other vaccine sites in Erie County, hospitals, healthcare organizations. We know that more than 30,000 doses as of a couple days ago had been given by the Western New York region. I'm still waiting for better data. I've been told by New York State that we're going to get more accurate data on the number of individuals who've been vaccinated on a first dose and second dose basis as we move forward, hoping to receive that on Mondays going forward. I want to reiterate that COVID-19 vaccine will not be available to the general population for several months. And as President-elect Biden noted last week, or at the beginning of last week, if we continue at the current pace we're doing in the United States, we would not be able to vaccinate everyone at least until 2022. So when we say several months, we're not talking about March or April. We're talking about getting vaccine into the arms of all who want it by late summer, early fall, potentially at the earliest, and maybe even going into 2022. 3 sites have been set up by Erie County, North, Central, and South. We are not identifying the location because these are all appointment by only. What we saw when New York State mistakenly put our sexually health our STD clinic, our sexually transmitted disease clinic, as the location to get vaccines, our people showed up without an appointment demanding their vaccine because they were in the 1B group. We do not want to list the sites because what we're afraid will happen, as we saw on yesterday, is people will just show up demanding they get the vaccine even though they have not scheduled an appointment. We have appointments scheduled, most of them which have been taken up all the way through the remainder of this month. We have scheduled appointments for the Phase 1A and 1B group through January 30th. Our schedule and ability to vaccinate depends solely on receiving vaccines from the New York State Department of Health. We do not have another source. We either get the vaccines from the New York State Department of Health or they authorize the transfer of vaccine doses from another location. Supplies are extremely limited. As of the moment we're speaking right now, we have now enough vaccines to get us through the remainder of today and we believe tomorrow for the clinics that we have scheduled for tomorrow. We have scheduled clinics for Thursday and Friday of this week. We do not have the vaccine doses on hand for those clinics. We are expecting to receive vaccine doses, approximately another 4,000 from New York State, hopefully tomorrow, but we do not have them. And usually we get a warning from UPS saying they're going to be delivered by UPS to Erie County at this time. We haven't even gotten that warning yet. So I want to stress to the public who think they can walk in and get a vaccine anywhere right now with Erie County, that is not the case. And all appointments are dependent upon actually having doses on hand. We have enough doses on hand to vaccinate the remainder of the people today, and now we believe also the people who are scheduled for tomorrow. But it is possible that we will have to cancel appointments for future days if we do not receive sufficient supply. As I put out on social media earlier, New York State as a whole has received on average about 300,000 doses a week for the entire state. The state, New York State Department of Health, then takes those 300,000 doses and it divides them proportionally by population. Erie County is the largest county in upstate New York, north of Westchester County. So we'll get more doses on a weekly basis than any other county. And Western New York will get its doses based on its proportion of population. However, when you think about it, there are 300,000 doses coming from the federal government to New York State on a weekly basis. And when you have New York City and Westchester County and Long Island making up the vast majority of the population of our state, 50% plus, at least 150,000 of those doses are going to go right away to the New York City area. So I want the public to understand we've had a lot of people reach out. We had 18,500 calls yesterday to our general number requesting an appointment and trying to make an appointment for vaccine delivery to the 1A or 1B categories. We currently have all scheduled vaccine pods for the 1B category full through January 30th. We've added some additional 1A pods for next week. So if you are a healthcare worker in the 1A category, we are adding 1A category pods next week. You can sign up for those through a web link that is available, and we will if you've requested as a 1A individual to get a vaccine, you will get that link through the Erie County Department of Health. We do note all of these are dependent upon getting vaccine. Right now, we only have vaccine to get us through tomorrow. Now, the New York State has a vaccine hotline, which is 1-833-NYS for VAX. Under New York State rules, Phase 1A and 1B are eligible now. Erie County is not the only agency distributing vaccines. There are other locations in our community that are distributing it. I know if you go to the New York State website, it tells you the only place you can go is the Erie County Department of Health. That is inaccurate. It is not true. Their hospitals have them, federally qualified health centers have them, and very soon pharmacies will have them. And we've been told by New York State that the pharmacies are going to be the primary location that will be vaccinating seniors 65 and older. If you are under quarantine or isolation, you are not eligible to receive the vaccine. If you just came off of COVID-19 and it's been less than 90 days since you had COVID-19, you're not eligible for the vaccine. Please do not call the Erie County Department of Health for vaccine appointments. We are not taking calls at this time for vaccine appointments. We have a form that can be filled online. People can fill it for family members who are incapable of doing it. We will then contact those individuals about clinics as they open up. It's been a very, very trying time. I know people want the vaccine. We want people to understand that we want to deliver the vaccine. We need more doses from New York State. They've pledged to us they're going to give us more doses. We need the federal government to release more doses to the states so we can put more vaccine in the arms of our citizens. But it's going to be months before we're able to get through the 1A and 1B category, because even in the 1A category, the vast majority of individuals who qualify in the 1A category in Erie County and Western New York have not received their second dose yet. And you need 2 doses to receive the protection that the vaccine will provide. 1 dose will only give you partial protection and you are still vulnerable for catching COVID-19 and getting sick. 2 doses will give you 95% protection. But if you don't get the second dose, you're still vulnerable to getting very sick. So we want people to understand it's going to take some time to finish the 1A category and months. New York State has said at least 14 weeks, which is until April, to get through the 1B category. And I'm going to turn it over to Dr. Burstein to finish talking about vaccines. And I know a lot of people have questions on it. We are doing the best that we can. We were thrown for a loop when on Friday the governor announced that 1B category would be open, because we had told it would be some time before that would happen and we'd be given ample time to prepare for it. Not just Erie County, all counties. All counties across New York State are dealing with this. I've talked to my colleagues across New York State. I've talked to some, I've texted some, and everyone's in the same boat. This is not a political matter. This is not Democratic or Republican. We want to deliver vaccines. We need more vaccines. We were all just kind of thrown for a loop when they announced that the 1B category would be eligible starting yesterday. So, Dr. Burstein.
Thank you. So if you are fortunate enough to get an appointment, you have to bring documentation, proof that you do have an appointment. As the county executive mentioned, people are just showing up, try to get a vaccine, and we are all really frustrated. We want to get arms in every single person in Erie County. However, we only have a limited supply right now, and we can only have enough to give to the people that have an appointment for the next 2 days. So please bring your confirmation ticket, and also you can print it out or have it available on your phone as a screenshot. Bring some ID to make sure that we can validate who you are, and also bring documentation from your employment that you are eligible, or your ID with your birth date. If when we get to the 1B category for our seniors, to as proof that you are eligible in 1A or 1B. And so please do not call the pod site. Please do not call the health department. Unfortunately, right now we are only taking appointments online. So that leads me to my next point is if you have a senior in your life who is eligible for a vaccine because they're 65 or up, and they may be struggling with with trying to navigate with their phone to make an appointment or online to make an appointment, help them out. For a lot of young people, this is something that's easy to do. So if there's an older person in your life that is having a little bit trouble with technology, just go over and give them a hand and help them out. And you can even do it virtually. You can do it on your own phone or your own laptop in your own home, and then and print out the link and scoot it under their door. And remember, we are prioritizing people in phase 1A and 1B because they are most at risk of COVID-19 exposure for what they have to do professionally to help other people stay well, or help other people stay educated, or help other people stay safe. And vaccinating people in phase 1A and 1B, as the county executive mentioned, is going to take months. And I know there are people that are so frustrated. Like, we all want to get our vaccine now. We all want to get as protected as soon as possible. However, our hands are tied. The Erie County Health Department and the other local health departments, we're just the messenger. Please don't shoot us. I can assure you that in Erie County, we are equipped, we are ready, we have pods that are open, we have staff that are available, we have more staff that we can call in. If we get more vaccine supply, we can really ramp it up. We can expand the appointments that we have available. We are ready to get shots in arms. We are just waiting for the vaccine supply from the state, and the state is waiting for the vaccine supply of the federal government. So I know that we're all really frustrated and all really angry. So let's turn this into some type of productive and positive energy, and until we can get protected from COVID-19 through a vaccine, let's remember to use our energy to practice preventive behaviors by masking, social distancing, avoid small gatherings in addition to large gatherings. Watching the Bills this weekend, if you're not going to the game, please, stay at home, watch it with the people that are in your own personal space. And we can stay healthy enough so that when it is your time to get the vaccine, you'll have been COVID-free and you'll be eligible to get that vaccine right away. So with that, I'm going to turn it over to our county executive for questions and answers.
Thank you, Dr. Burstein. Before we go into the Q&A, I want to note a few other things. People are probably wondering why we are scheduling appointments when we don't have vaccine. We were told by New York State to do that. I actually, on a call I had yesterday with key New York State officials, I brought it up and asked them specifically, you want us to schedule and create point-of-distribution clinic appointments in the future, even though we do not have vaccine? And their answer was yes. So I want people to understand we are taking our orders from New York State on this. That's why we have point-of-distribution clinics scheduled beyond our vaccine supply, which is truthfully through tomorrow. If we do not get new vaccine, then we are going to have to cancel appointments. It's not a thing that I'm really, let me backtrack. I wish we didn't have to do this, but we've been told to go about it this method. We are going about this method. So people who are wondering why there's not more appointments available, part of it is because the appointments are only based on what we think we can do in a period in the future. We're not going to say we can do 10,000 vaccines a day when we've been doing 1,200 vaccines a day. So we're scheduling in the future based on what we've been able to do in the last week, and we will continue to schedule based on not only demand, but the supply that we receive from New York State. And then I want to finish, before we take Q&A, talking about the orange zone in Erie County. For the last few weeks, I've been communicating with high-level staff members in the Cuomo administration, including over this weekend with the governor himself. I do not believe it's fair for the entire portion that's in the orange zone to stay in the orange zone when we have numbers that are better than other parts of New York State. I have told the governor that. He gave me his word. They were looking at it. I hope they move our community to the yellow. I will note this. If Erie County should stay in the orange, then almost all of upstate New York should be in the orange. And I'm not trying to throw other areas in upstate under the bus, but I'm saying if we're in the orange and we're doing better than other parts of upstate New York, then why aren't they in the orange? So I have called on the governor. He's heard this directly from me. I think we're doing better. We've done a little bit better with our hospitalizations lately. We've done better, certainly, with our cases in the last week. We had the 1 week blip, which we believe was directly attributable to a Christmas, New Year's spike. We are starting to see little better numbers, not great numbers. There are parts of our community that are doing very well. And I want to thank those in those communities for doing very well. To the areas that aren't doing very well, I need you to do better. We all need us to do better. Even if you get the vaccine, it's possible that you can still transmit the vaccine even if you're not sick. The one thing we know is there is a lot of asymptomatic transmission in the community. People who have the illness don't know it because they're not showing any symptoms, but can spread it to other people. And there still is a question as to whether or not, even after getting both doses of the vaccine, can you then spread the vaccine to other people? We don't know the answer to that question yet. So we're still going to have to wear our masks, even if you had 2 doses of the vaccine, to protect other people, even if you aren't yourself at risk to getting sick. So when it comes to vaccine delivery, we are doing the best that we can. It is a difficult time. I want to commend all of the individuals that are out there delivering vaccines in our community. It's not just the Erie County Department of Health. There are others. And I want to ask people, if you talk to our staff, please do not be rude to them. I was told by a couple members of our Department of Health staff that the individuals who were taking phone calls, and even those that were showing up at our sexually transmitted disease clinic where there was no vaccine, were talked to and treated rudely by members of the public. Please don't do that. Everybody wants to deliver the vaccine as quickly as possible, but we have a limited supply. We have limited locations. We just ask everyone to do better. We are all in this together. We were all in this together for the last year, and we're still going to be all in this together for the next year. And hopefully very soon we will have a change with regards to Erie County's cluster zone from orange at least to yellow. There are some parts of our community that are not doing as well as others, but it would be unfair to hold the whole community hostage because of a few portions of our community that are not doing as well. And certainly it is unfair to hold our community in the orange zone when there are other parts of Western New York that are doing much worse, or for that matter, other parts of upstate that are doing much worse than Erie County and are either in a yellow zone or no zone at all. With that, I will open it up to questions, and we will start from the top, which on my sheet is WKBW Television.
Hi, Mark. It's Madison.
Hi, Madison.
Sorry, I got on late. I missed the new time, so I don't know if I missed this, but do you know how many people, or Dr. Burstein, how many people have been fully vaccinated with the 2 doses yet?
I know as it comes to the county, that's 0. It's possible in the Western New York region that there are some who've received 2 doses yet. Remember, it's basically 4 weeks from when you received the first dose, which was the Pfizer vaccine, and it's 3 weeks from the first dose of the Moderna vaccine. No one that's been vaccinated by Erie County would have gotten their second dose yet. The hospitals may have vaccinated someone with a second dose already because they were the first to do it, but I have not been given that information by New York State. I do not know the answer to that question. WIBV TV, Chris Orvadas.
Hey, Mark. Hearing you talk about the vaccine today, you sound about as ticked off as I've heard you over the past year. Is that because of the confusion that's out there? Is that because of the way that people are, you reference people are treating county employees badly? I mean, what's going into the frustration here over all this? And why can't we all get it right here?
Well, we are unfortunately at the mercy of New York State in the vaccine doses, as well as the determination of what's in the 1A, the 1B category. I have to admit, as I said earlier, we were a little surprised when the governor announced on Friday that he was going to allow the vaccinations of 1Bs starting on Monday. I had been involved with a conference call with Howard Zucker and Larry Schwartz the prior day, Thursday, with other county executives, and it was never brought up. So we were surprised, and as a result, I had a bad feeling about how Monday was going to go, and it didn't go well. We were also told that New York State was going to have a separate web link as well as phone number to schedule appointments. And of course, yesterday morning, New York State put on its site, if you qualified, to contact the Erie County Department of Health. And that caused a lot of problems with our Erie County Department of Health. It's not gone as smoothly as anyone would like. It's not. I'm going to be the first to admit that. I've spent the last 36 hours fielding a lot of questions from people that I know in county government, outside county government. We had a conference call yesterday with supervisors and mayors with regards to the vaccine delivery and how things are moving. And I just wish we would have gotten more advance notice with regards to the 1B category. Instead of having a weekend, what we thought we were going to get was at least a week or two advance notice. We didn't. It happened, so be it. You move on, you deal with it, but it caused a lot of problems. And even today, the 1B category was changed. We've received more information on additional areas that concern, or areas of concern that now qualify. As of yesterday, it was 75 plus. As of today, it's 65 plus. And trust me, I want to get those people vaccinated. Those are the most at-risk individuals. Those are the people who should be getting vaccinated. A 25-year-old teacher who is doing their job virtually and is not at risk, I understand the teachers want to get vaccinated, but our 75-year-olds are much at risk for hospitalization and deaths than our 25 and 30-year-olds. But they were all put in the same pool together. And that made it very difficult to handle what I want to remind everybody. Under the census numbers for the 65 and plus category in Erie County, we're talking about 175,000 adults. When you include all police and fire, all correctional officers, all teachers, we believe, our youth detention facility staff, individuals associated with forward-going aspects of our Department of Social Services. It is easily 300,000 plus individuals that qualify in the 1A and 1B category. And right now, we have about 1,000 doses left on hand. So it's going to take a long time. We wish we had more time to prepare for 1B. We weren't given it. We thought we were going to continue to do the 1A category based on information that was provided from New York State. It changed. Okay. It's just a lot of people in a very short period of time are now eligible for the vaccine. And as has been noted repeatedly, it's going to take months. New York State said 14 weeks. 14 weeks is in April to early May. It's going to take a lot of time before we get everybody in the 1A and 1B category vaccinated. And I just ask for patience as hopefully more vaccine will be distributed to New York State and then distributed to Western New York starting next week, as President-elect Biden has said he will do. WGRZ-TV, Kelly Dudzik.
Hi, Mark. Have you gotten any indication as to who will be included in the immunocompromised group that was also added today along with the 65 plus people? Because we've got a lot of people asking about that.
I have not. I don't think we have yet. No, I'm looking at Dr. Burstein. She's nodding her head in the negative. If it goes by what we've seen in the past, when the state announces the new additions to the group, we will get the guidance from New York State generally the next day. So once we get that guidance, which will probably be tomorrow, we will share that information. But as of now, we have not received that guidance. Spectrum News.
Yes. Hi, Mark. Just wondering if the number of vaccines the county starts to receive is ramped up significantly, how many vaccines is the county prepared to give out in a day or a week?
Well, the number varies based on our pods. I think yesterday we did about 1,200 vaccines. Yeah, we did about 1,400 vaccines in a one-day period, and that was at 2 locations, which were all by appointment only. So we can do a lot in a day. We can get a lot of vaccines out in a day. Our goal is to have 3 pods eventually, but there's no reason to have the 3rd pod open right now because we don't have vaccines to distribute at that 3rd pod. So if we could get all 3 pods ramped up, we could easily get around 2,100 vaccine doses a day if they're all ramped up and are going as we've seen recently. So yeah, we could get 2,000 doses probably done a day if all 3 of our pods are up and running as they have been recently. But right now we don't have enough vaccines to get to 3 pods. And remember, there are going to be other areas that get it as well. This is a supply issue. It's not a logistics issue for Erie County. We have 3 point of distribution clinics locations identified. We have some other ones that would be larger, much larger as we get into the general public scheme of it later in the summer. It is not an issue with regards to our ability to ramp up. We have them identified. We have the staff identified. We are ready to increase our vaccine distribution capability. We just need the vaccines to do it. The Buffalo News.
Hi, Mark. So, given that there are more than 300,000 people who are eligible for the vaccine in Group 1B and the limited supplies the county has, what is your advice to folks who qualify? I mean, as you had stated, they are very frustrated. They've been told they can get the vaccine, but realistically, they don't seem to be able to. So, what is it you're asking them to do at this point, given that they're eligible but can't seem to get a hold of any? I'm also curious as to the state's response as to why it wants you to make appointments for vaccine you're not sure you're going to have.
Well, regarding the first one, I just ask patience on the public's part. It's going to take some time. As the governor and the state announced, it'll be at least 14 weeks based on their estimate to get through the 1B category based on the amount of vaccines they've been receiving and the actual number of individuals in that 1B category. And that was before they started adding other groups, so it might even take longer now. I do ask, I have not received the vaccine. I've always had questions. Have you received the vaccine? I have not gotten my first dose of vaccine yet. Dr. Burstein got her first dose of vaccine, and she's been working in the clinic, actually delivering doses to individuals so that we can have as many people in the clinic at any one time. I would ask those that are healthy, that are younger, that may qualify, if they're not at risk, wait. Let our individuals who are most at risk get the vaccine doses first. Our older population is more at risk to getting hospitalized and death. 80% of deaths in Erie County are for those over the age of 70. We've had deaths under the age of 40, but very few. And even in between 40 and 50, not that many. Actually, I can go back and I think I have, yeah, we have the mortality data here. Oh, I'm sorry, actually I do. So we've had 15 people die since the beginning of under the age of 40, 17 40 to 49. But we've had 301 die between the ages of 70 to 79 and 778 die between 80 plus. I would really hope that we are able to vaccinate that older population, working with the pharmacies and the other sites that will be vaccinating, the healthcare centers, sooner. But for those who take up slots that are younger, that because your group qualifies, we're just not able to get that older population done as quick. The governor mentioned earlier today that on his call that the county health departments are going to be responsible for primarily police and fire and other first responders. Yet the New York State Department of Health is directing everyone who qualifies to the Erie County Department of Health. It's tough. And we're just asking those to think, you know what, I'm 30 years old, I technically qualify because of the group I'm in, maybe I'm a teacher, maybe you work in corrections and you qualify, but you're in the office in corrections. Maybe it would be better if your grandparent or your parent got the vaccine before you did. I know that this is a decision each individual is going to have to make. I'm not getting my vaccine until I'm eligible, and I'm certainly not going to get my vaccine before my parents get their vaccine. That would be stupid. So I want people to think, try to realize that it's going to take months. We want people who are most at risk of catching COVID and dying from it to truly get the vaccine before someone who is not at higher risk. It may sound not so good because we want to have equity. We want to ensure that it's equitable throughout all of the divisions, but we also want to ensure that individuals who may not be technologically savvy, who the most technological advanced instrument they have is a flip phone, has an availability through the mechanisms that exist to get a vaccine appointment scheduled as compared to someone who knows how to do it and can do it just like that. And then with regards to your second question, I specifically asked that question on the call yesterday, which was a call in which all Western New York and Finger Lakes Regional Hub participants were on. P.J. Wendell, Chautauqua County Executive, was on. Adam Bello, Monroe County Executive, was on. Former Lieutenant Governor Robert Duffy was on, as well as our current Lieutenant Governor, Kathy Hochul. I asked that question because I wanted a direct answer from New York State. Do you want us to schedule appointments for the COVID-19 vaccine, even though we do not have vaccine on hand? And their answer was yes. And my response to them was, okay, we can do that, but you are on the gun to deliver the vaccine to us. Because if we do not get the vaccine, we are going to have to call those people and cancel it, and they're going to be rightly angry.
Restaurants that hosted outdoor viewing events last week in a bind because of the orange zone restrictions that closed outdoor dining at 10 p.m. I know you said that you're not a big fan of Erie County still being in the orange zone, but there is an effort underway to lobby the governor to amend that, at least for Saturday. Are you hopeful at all that that could happen?
It is part of the conversations we've had. I'm hopeful we just move to the yellow. It is a question that our Department of Health is receiving from restaurants, and we've passed on to New York State. It is a legitimate concern. We have an 8 o'clock or 8:15 game, which means it's probably not going to finish till after 11 o'clock. And it is a concern that we have passed on to New York State. They are aware of it. As I said, I don't believe when you make comparisons to rest of Western New York, and for that matter, other parts of New York State, we should be in the orange. Because if we're in the orange and they keep us in the orange, then everyone else should be in the orange. And I know my fellow county leaders from other counties won't like to hear that, but we got to be treated fairly. You cannot treat one county differently than another county. It should be treated the same. If you're going to have a standard with regards to new cases and hospitalizations, well, then stick to that standard. Our new cases, we're starting to see a little reduction with regards to the percentage positive on a daily basis, and we definitely have seen a reduction with regards to hospitalizations. So I just have asked New York State, and I continue to call on New York State, treat us fairly so that we are treated no differently than any other county. And the counties that are worse than us, if you're going to keep us in an orange, then you should put them in an orange too. And I know my colleagues from those counties are probably not happy hearing me say that, but it's all about being treated fairly. WBEN, Mike Baggerman.
Hey, Mark, I appreciate you clearing up a lot of the confusion about the vaccine eligibility and, talking about how you want more advance notice from New York State. But my question to you is, what do you want the state to do now to try to mitigate the confusion? Now that there's already the confusion out there, what can the state do to make your life and the other county workers' lives easier?
Well, the one thing we were working with New York State was to change the information that was being provided in New York State. Originally, yesterday morning, they had put down that our sexually transmitted disease clinic on William Street was the location to get vaccines, and put down our general number as the number to call for an appointment. They did change that. I do apologize to the people in Erie County who saw that and showed up at our clinic, even though it said it's by appointment only. I mean, there was inaccurate information that was put on there by New York State, and I apologize to those who reacted based on it. We're trying to get and work with New York State to ensure that the individuals who've requested a vaccine that are in the 1B category have access to the 1B category. That requires us to get more vaccines. We've scheduled all the way through January. We have not opened up pod clinic sites yet on the state site for February. We understand when that happens. They'll get full pretty quickly. But we're working with New York State to at least ensure that the information going forward is accurate. Anybody else that is on the call that I did not identify earlier? If not,
Hey, County Executive, it's Ally Tui. I don't know if you're going to go back. Through
yeah, I was going to go back from the
I-
top. So go ahead, Ally. You get the last
Okay,
bite
thanks.
for Channel 7.
Okay, great. Hey, listen, I know that, you mentioned not publicizing where these pod locations will be, but other counties certainly have. You've compared us to maybe Monroe, where I know they have identified a pod location. So I guess in the interest of transparency, and as word spreads of appointment requirements, might you release the pod location?
Well, we release the pod location to the individuals when they sign up. They get their location. It's not like that's hidden. They know about it at the time they sign up. So we do not hide that to the individual. They need to know where they're going. But what we saw yesterday was indicative of what we're worried about, which was people just started showing up at our STD clinic demanding to get vaccinated because New York State said they could get vaccinated. And what we're afraid of is people showing up at these other locations and doing the same. These are all by appointment only. And we're trying to avoid issues with people showing up who are agitated, who think they can get a vaccine at that location. We have to have security at these locations now because of actually seeing what's happened elsewhere. We know people are angry and they want to get the vaccine as quickly as possible, and we're trying to get it as quickly as possible. But we are a little afraid after what we saw yesterday that individuals, if they know where the vaccine location is, they're going to show up regardless of whether they qualify. First off, they might not even qualify, or even if they qualify, don't have an appointment, and then it causes a lot of problems. So for the time being, we are notifying the individuals who actually have an appointment of the location and the time, because they have to come at a particular time. WIVB, Chris Horvatis, or anybody else from IVB?
Yeah, have you, Mark, has the county had to cancel any appointments thus far because there's been no vaccine on hand? And can you explain to us the process of, how you find out how many doses of the vaccine the state is sending to you each day? What's that communication process like? How do you receive it? Where do you receive it? I know there's some security concerns that are probably going to preclude you from answering some of that, but can you tell us what you can tell us? Well,
we only receive it once a week. We don't receive vaccine doses daily. As of right now, we've received them at best once a week. We were actually going to run out of doses as of the end of today, but we were able, through the authorization, to procure another 1,000 doses from Roswell Park and another 100 doses that were with hospice. So those doses are being transferred to Erie County today to be used at tomorrow's point of distribution clinics. We've been advised we're going to get 4,000 or so doses by the end of this week, but we don't know the exact time and date in which those are arriving. We do have a location that receives the doses, but I'd rather not say that publicly because we fear that of potential for theft. There is a black market out there, it appears, for doses that was seen downstate, in which doses were taken away as they should have been used, and they were being basically sold and used by others. So we only get doses once a week. It's not a daily process. I'm hoping someday it'll become a daily process, but right now we only get doses once a week. And then if there are extra doses at another location, we have to get approval from New York State and it usually takes 24 hours for that approval to come through before they can be transferred. So the doses that we're getting from Roswell Park and Hospice, we requested those in the last 48 hours, and we just got approval from New York State to do it, and those doses are coming in, or have come in, I think, or are coming in today. So I look at it this way. It's not what people think. We are not getting thousands of doses a day from New York State. New York State has 300,000 doses a week they receive from the federal government. The Biden administration has said they're going to release more doses to the states starting their first week in office. And I would assume as a result of that, more doses will be coming to Erie County in the future. But right now, it's a very limited supply. And when we say a very limited supply, I'm talking about we got enough doses to get through tomorrow. Hopefully we get more doses so we can do Thursday, Friday, and Saturday's pods. It's not, they talk about, there's two things you don't want to watch. It's sausage making and legislation and government at work. Well, add three. It's the third is vaccine delivery, because it is ugly everywhere. And I know that's not what people want me to say, but it's not what we're hoping it would be. And it's not just Erie County, it's not just New York State, it's like it everywhere. I know it's terrible across the border in Canada. I know it's bad in Ohio. I know it's bad in Texas, because I talked to a friend of mine from Texas, a colleague. It's not what we had hoped it would be, but it's moving along. There are some things you don't want to watch being made, legislation, sausage, and as it comes to it now, maybe it also includes vaccine delivery, but I guarantee to the people of Erie County, we are working exceptionally hard to give you every dose we possibly have. Through yesterday, not a single dose had been wasted by the Erie County Department of Health. Every dose that we had is going into the arm of somebody, and it's going to continue that way as long as I'm county executive. I think next is WGRZ TV.
Yeah, bottom line, if somebody's in phase 1A or 1B, what do they need to do so that they're not calling the wrong phone number and bothering somebody who's working for the county or working at a pharmacy? What does somebody need to do to make one of these appointments?
There's a form online through our Erie County Department of Health that you can fill out. You identify your category, it comes to our Department of Health, and then when the clinics are open, they will contact you to allow you to sign up for the clinic. As I noted, right now we have a clinic starting, I think on the 19th for a few days. It's only going to be for the 1A category. It is not going to be for the 1B category. We are trying to finish the 1A category because we've been told to finish the 1A category. So those individuals that signed up through our form in the 1A category will be getting information from the Erie County Department of Health telling them to sign up for that clinic or the clinics on the days that follow. Spectrum News. And just before Spectrum News starts, that form is on our Erie County Department of Health website. Spectrum News, any more questions?
Yeah, just one more to pivot slightly away from the vaccine talk. Is there any extra security being added to the RAS building or for yourself right now with all of the threats that the FBI is getting leading up to the inauguration?
I do not discuss the security or level of it at any one time, but I can discuss that there have been conversations between my administration, representatives of the Sheriff's Office, representatives of the Central Police Services, our Department of Homeland Security and Emergency Services about what we are very worried about, the threats against state capitals and what potentially could happen in our own community. We do know that there were individuals who traveled to Washington, D.C. from Western New York who participated in the attack on the Capitol. And I am certain, based on the information that I've received, that there are individuals who, if not going to Albany or D.C., will still be here, who believe that the election was stolen. The election was not stolen. Joe Biden handily won. It's been confirmed by Republican Board of Elections and elections officials across the United States. There was no steal. The only attempt to steal the election was done by President Trump and those who stormed the Capitol with the insurrection last week. I'm hoping it doesn't happen, but as we know and has been advertised, there are going to, in all likelihood, be armed protests in Washington, D.C., and state capitals starting the 16th through the 20th. And we are not taking anything for granted here. While we're not a state capital, we do anticipate that there could be protests. I've always said I'm not against protests. You have a First Amendment right to protest. If you protest and you're going to be with a group of individuals, please wear a mask. Those are super spreader events otherwise. But we've never seen an armed protest in our region that is visible like you've seen in other areas where people are carrying long guns and the like. I would certainly hope that wouldn't happen here. You cannot carry a long gun in the city of Buffalo, and we will be prepared for whatever is provided or whatever happens, but I'm not going to talk about the levels of security. But I will just say this, we are aware of it in Erie County with the leadership of multiple departments in the Erie County Sheriff's Office, and we'll be prepared for whatever happens. Next question goes back to the Buffalo News.
Hi, so the governor at his State of the State address referred to the expansion of rapid testing centers for COVID-19 to help reopen the economy. And I'm wondering if you've gotten any more information or insight to how that might roll out here and what it might mean.
I really don't, Sandra. We heard of it was when the governor announced it. I will note that the governor talked about the success of the rapid tests with the bills. Those were not rapid tests. Those were PCR tests that were driven from the site in Orchard Park to New Jersey. It just goes to show you can do a test within 24 hours, but it wasn't the traditional rapid test where you get a response in 15 minutes. The only thing I would note with regards to rapid tests is there's two different rapid tests. There's the Abbott ID Now, and then there's the Abbott Binax Now. The Abbott ID Now is very good at identifying individuals who have COVID-19 that are both symptomatic and asymptomatic. The Binax Now is very good at identifying someone who's COVID-19 if they're symptomatic. It's not so good if they're asymptomatic. So if you're going to increase rapid tests, you're going to have the Abbott ID Now as the one you're increasing, because you do not want to increase rapid tests with a test, the Binax Now, which is not as good at identifying asymptomatic individuals. So if they are going to do increasing the number of rapid test sites across New York State, I'm hopeful that it actually is the Abbott ID Now test that is primarily used, not the Binax Now test. WBFO, Ryan, do you have any more questions?
No, I'm good. Thank you.
Okay, then the last question will go to Mike Baggerman. Do you have any more questions, Michael?
Yeah, it's a two-part question, Mark. The first is the governor yesterday announced that Bills fans could come back to the divisional round games. We don't know about the AFC Championship, if that's a possibility. I just wanted to get your comments on the county's preparedness for the home games. And also, with only 1.9% of people testing positive ahead of last weekend's game, what sort of conclusions do you draw about COVID-19 in the community, given that a lot of those people were either asymptomatic or had something as minor as a runny nose?
Well, it just goes to show, with regards to the second part of your question, that you can be asymptomatic and have COVID. Because what we've heard is of those people who tested positive, almost all of them, not all, but almost all of them were asymptomatic or had what you just described, a runny nose. And I think a lot of those people were surprised, is what I've heard, that how could I be positive? Well, you were positive because you're asymptomatic. That doesn't mean just because you're asymptomatic, you can't get the illness or have it. So I think it's important that people understand that it's out there, that COVID-19 is still in our community, and just because somebody looks healthy doesn't mean they don't have it. And then with regards to the first part of your question, Erie County is prepared to do as we did last week. We are always at the football games, regardless of whether or not there's fans in the stands. We had a larger contingent of individuals there this past week because of fans being in the stands, but we will be there. The Bills, of course, have already announced they've sold out the tickets for the Ravens game, and those individuals will be tested, I think, starting, if not today, tomorrow. I thought they were starting, but it would be better off when they were starting. It would be better off to get that information from the Bills. So that's going to continue as it did. People will go to Orchard Park. They will get swabbed. Those swabs will be taken in New Jersey, and they'll have an answer within 24 hours. If the person's an Erie County resident and they test positive, we'll get that information, and we'll do contact tracing thereafter. It's really no different than last week. I'm glad we got the reports that things went well. People followed the rules. They pulled in the lot, they stayed in their cars until it was time to enter. They went to the gate that they went to. There was no tailgating that I'm aware of. There were 10 ejections, 10 ejections, and I believe almost every one of those was related to someone who wasn't wearing a mask. And then there was one arrest, and I've been told the arrest was someone who was ejected who tried to get back into the facility. So if you're going to Saturday's game, wear your damn mask for the whole time and you'll be having a great time. Don't take your mask off and think, I'm gonna be able to do this without a mask. Wear your mask and you'll enjoy the Bills game and we will all root them on to victory. But wear your mask because that's the rule. And that's how we're able to get more people in or back in. And if we had hundreds of individuals that weren't wearing their masks, then maybe New York State would have said it failed. It didn't go well because people weren't listening, but because it was such a small amount, it's okay. And I just want to thank everyone for following the rules because it now gives an opportunity for another group of season ticket holders to attend the game. With that, we'll wrap up for the day. I just once again want to remind everybody, please be patient when it comes to the vaccine delivery. We now are in the 1B category. And there are hundreds of thousands of people just in Erie County alone who qualify in the 1B category. We're not even talking about all of Western New York. It's going to take some time to deliver vaccines to everyone in the 1B category because we haven't even finished the 1A category just yet. I thank everyone for what the work they've done these last almost full year now, at least since March, in dealing with one of the items in our lives which we'll never forget, a global pandemic that has unfortunately taken more than 1,000 of our Erie County neighbors. We do mourn all of those. I know people who've lost family members. I know people who've lost friends. And I just hope that we can all do together what is necessary to protect as many people as possible until we can get them all vaccinated. It's going to take months to vaccinate everyone in the 1A and 1B category. It's going to take a lot longer than that to do the otherwise portion of the general public that is going to be wants the vaccine. So please, wear a mask, wash your hands, try not to touch your face as much as I did. I realize I'm touching my face more with the beard because it's itchy, so I don't know how much longer the beard's going to be on. But be safe and well in everyone, and unless we have a reason to come before you, again, this is the only press briefing we'll do on COVID-19 this week. So go Bills. 1 down, 3 more to go. Take care, everyone.